Hey guys, hope you're having a good time off. I'm going to go ahead and record some stuff for this week as well so we don't get behind in our content. So, this is going to be chapters 19, 20, and 21 for your community class. So, let me see if I can pull up um, chapter 19 and we'll start there. Okay, so this chapter is about population-centered nursing in rural and urban environments. So the things that we're going to try to accomplish in this chapter is we're going to compare and contrast definitions of rural and urban. We're going to describe residency as a continuum, ranging from farm residency to core inner city. We're going to compare and contrast the health status of rural and urban populations on select health measures. And then we're going to analyze barriers to care in health professional shortage areas and for underserved populations. We also want to evaluate issues related to delivery of public health services for rural underserved populations. We're going to describe characteristics of rural and small town residency. And then we're going to examine the role and scope of public health nursing practice in rural and underserved areas. And then the last thing is evaluate two professional client community partnership models that can effectively provide a continuum of health to residents living in an environment with sparse resources. Okay, so the first part of this talks about some history. So the Red Cross Rural Nursing Service was something that came about back in 1912. Before this, care of the sick in small communities was provided by informal social support systems. So there's some specific problems in rural communities, and we've seen this over generations. So one of the things is that there's a maldistribution of health professionals. As you get further and further away from big cities, you don't see very many options for going to a healthcare professional. You have to pretty much go a long way to get to one. A lot of times people that live out kind of far live in poverty. So, like, for instance, if you went down into the like mountain areas down in Kentucky and stuff, a lot of people down there live in poverty. They also have limited access to services. So, and we're talking all kinds of services like transportation, we're talking about like internet access, you name it. They have limited access to services. Some of them have ignorance about different healthcare things, like they just don't know any better because they've never been taught. And then they're very socially isolated from, the rest of the population. So that's another problem. Okay, so there's a couple definitions here. So I can't say it, rurality is a subjective concept. And then rural-urban continuum, we're going to be talking about that here in a second. So rurality. So what this means, rural is defined in terms of geographic location and population density, or it may be described in terms of distance from, like 20 miles, or the time, like 30 minutes, needed to commute to an urban center. So there is an increasing urban influence with rurality. So its differences in rural versus urban is less significant now. There's multiple definitions to what rural really means. Farm residency versus non-farm residency, and then each town is very distinct. So when we talk about the rural-urban continuum, this says relative nature of ruralness, like how far out are we from, the rest of the population. Rural-urban continuum. So rural and urban residencies are not opposing lifestyles. They must be seen on a wider range. So for example, remote farm to village to small town to larger town or city to large metropolitan area with a core inner city. All right, so geographic entities. Core-based statistical area. So you can use this collective term for metro and micro areas. If you're talking about a metropolitan area, this is usually a core urban area of 50,000 or more. Micropolitan area is an urban core of at least 10,000 but less than 50,000, about 60% of the total non-metro population. Non-core area is no urban core but on average 14,000 residents. And then the suburbs is a donut effect. So, when you live in the suburbs, you're still kind of in the city, but you're out just a little ways from there, so you don't have all of the big problems that the city does. Okay, which makes up about 60% of the total non-metro population? Our answer is going to be B, the micropolitan area. So again, this just reviews what we just talked about. So metropolitan is a core urban area of 50,000 or more. Micropolitan would be urban core of at least 10,000 but less than 50,000. And then non-core, no urban core, but on average 14,000 residents. So when you look at the rural-urban continuum, here's a nice picture of it that illustrates kind of what it's like. So again, they have the micropolitan, metropolitan, and core there. So then they have terms, frontier, rural, and urban. So when you think frontier, you think like back in the Old West or something where you have hardly anyone around. So this is saying less than 6 persons per square mile. Rural would be a little bit more populated, so 7 to 98 persons per square mile. And then urban would be, bigger amounts of people, so more than 99 persons per square mile. So farm residency would be to the far left, suburban would be somewhere in the middle, and then non-farm residency would be to the far right. All right, so we're going to examine some current perspectives about population characteristics and health status of rural residents. So this list here is going to just tell you about some general trends. There are, of course, regional variations. For instance, some rural counties have a significant minority population. So here's kind of what they're saying. They say, when you talk about a rural area, usually it's more whites than any other type of race that's out in the rural areas. There's a higher proportion of younger, under 18 years of age, and older residents over 65 years of age. Usually these people are more likely to be married. Some of them may be widowed. They're more likely to be poor, fewer years of formal education, and at risk for being underinsured or uninsured. And then when you talk about their health status, rural adults are more likely than urban adults to have one or more of the following chronic conditions. So typically they would have a lot of heart disease, chronic obstructive pulmonary disease, hypertension, arthritis, rheumatism, diabetes, cardiovascular disease, and cancer. So again, they have a lot of different chronic illnesses usually. So some of them have a lot of physical limitations. They have, maybe they might have a little bit of availability and access to healthcare, but maybe they don't use it as much. There is a shortage of healthcare professionals out in rural areas. So some of the big problems that you could see that people just don't get addressed would be things like maternal and infant health. If it takes forever to go to the doctor to get looked at for maternal infant visits, then they probably just don't go. Mental health problems, health of minorities, environmental and occupational health risks. Now that's probably a big one there. So, think about all the people who farm. There's all kinds of like weird farming accidents and things like that that might happen. And it's going to take them forever to get somewhere to get looked at if something does happen. So lots of things to think about with the rural residents. Okay, so this slide's talking about rural healthcare delivery issues and barriers to care. So we kind of already mentioned a few, but the big one is lack of healthcare providers and services. They just don't have as many options for that where they live. It may take them a long distance to go actually find someone to get looked at. So, maybe I live up in the mountains and it takes me a good hour to get to the next city so that I can actually get some health care. A lot of people have lack of personal transportation. So maybe they don't own a car or they can't afford a bus ticket or something. Um, Maybe there's just unavailable public transportation where they're at. There's no established busing or train station or anything like that anywhere close by. A lot of people have a lack of telephone services, especially if they live really far out. Um, Unavailable outreach services, inequitable reimbursement policies for providers, unpredictable weather and travel conditions, that's kind of an issue sometimes. And then inability to pay for care or lack of health insurance. That's probably a really big issue for a lot of them. This kind of continues what we were just talking about. So lack of know-how to procure publicly funded entitlements and services. So maybe there is, some help available for them out there, but they don't know how to get it or they've never heard about it. Inadequate provider attitudes and understanding about rural populations. Language barriers, sometimes that's an issue. Caregivers are not linguistically competent. And then care and services not culturally and linguistically appropriate. So that could be another issue. Okay, so now we're going to talk about nursing care in rural environments. So things that we're going to discuss is theory, research and practice, research needs, and preparing nurses for rural practice settings. Okay, so the body of literature on rural health is growing. Most publications focused on hospital practice, but information is applicable to both community agencies and community-focused nursing. There is physical isolation, so professional isolation for nurses and practitioners. There's scarce financial, human, and healthcare resources, and it's a broad scope of practice. So it's very important that future research is done about rural practices and how to take care of some of these individuals in those areas, because it is a big problem. So some of the research needs would be greater recognition for rural nurses. Yes, that would be great. Stressors and rewards of rural practice. Empirical data on particular community nursing needs of rural client systems. International perspective, most efficient and effective way to use technology in rural healthcare, distance learning, and rural-urban disparities in health status. Okay, so to prepare nurses to go out in those settings to actually practice is kind of difficult. So rural nurses need a broad knowledge, including knowledge in these areas. They need to know things about health promotion, primary prevention, pediatrics, rehabilitation, obstetrics, medical surgical care, planning and implementing community assessments, understanding the public health risks and needs for emergency preparedness in a particular state. They need to know how to do telehealth. Telehealth uses a variety of technological solutions to provide preventative, promotive, and curative aspects of healthcare. So that would be very beneficial to them. So some examples of telehealth solutions would be communicating by email with clients, ordering medications from a pharmacy, consulting with other healthcare providers, accessing advanced or continued education offered by a university located some distance from the receiving site. Telecommunication technology could be as simple as nurses in 2 or more different public health settings consulting over the telephone or computer, via a video conference, coordinating local health fairs, or as complex as nurse scholars collaborating with international peers on a community health focused research project, or a medical specialist located at Health Science Center completing complex robotic surgical technology on a client who's located in another country. So, telehealth does a wide variety of things. And then as far as future perspectives go, there are scarce resources in comprehensive healthcare continuum. So Healthy People 2020 national healthcare objectives related to rural health would be something that we need to be really focusing in on. So as far as the scarce resources and comprehensive care continuum, so things that are needed in most rural areas would be things like school and parish nurses. If you had a really good school nurse, that would help tremendously in a rural community where maybe they don't get, health care hardly ever, but at least if they're at school, they can get some care. Parish nurses are great too, because if someone belongs to a church, that's their access to healthcare is this parish nurse. This parish nurse can, monitor blood pressures and monitor, the health of the people in that community. So that would be a great thing to have. Family planning services, prenatal and postpartum services, resources for clients with HIV and AIDS, emergency medical services, that would be great. Resources for families of children with special needs, including those who are physically and mentally challenged, mental health services, and resources for older adults. When you look at Healthy People 2020, the CDC's Healthy Communities Initiative, they talk about when implementing community-focused health plans that emerge from Healthy People 2020, consideration must be given to the rural context, such as the sparse population, the geographic remoteness, the scarce resources, personnel shortages, physical, emotional, and social isolation. It remains to be seen if a parallel rural compendium will be developed for Healthy People 2020. So some of the objectives that they have in Healthy People 2020 about rural areas are increase the proportion of persons with usual primary care providers, so give people more access to care. Reduce motor vehicle crash related deaths. Increase the proportion of adults with mental disorders who receive treatment. Reduce coronary heart disease deaths. Reduce fatal and non-fatal injuries. Those are some of the things they focus on. All right, and then this talks about building professional community client partnerships in rural settings. So as far as case management and community-oriented primary health care. So healthcare reform initiatives are focusing on cutting costs while improving access to care with equitable quality of all citizens, especially vulnerable and underserved populations. State and local grassroots organizations must be actively involved if healthcare reform succeeds in rural areas. Specifically, professional patient community partnerships are essential to accomplish reform at the local level. Nursing practice in rural areas is comprehensive and incorporates skills from nursing and public health. Two models have been found to be particularly useful for nurses in rural environments: case management and community-oriented primary health care. So when we talk about case management, a client professional partnership can be used to do the following. So if you arrange a continuum of care for rural clients with the case manager tailoring and blending formal and informal resources. It also allows clients participation in their care plan. Outcomes are often remarkably different when case management is used. So it is a really good thing. And then community-oriented primary health care. So this is an effective model for delivering services to vulnerable, underserved populations. It emphasizes flexibility, professional community partnerships, interprofessional involvement, problem-oriented approach, and a community grassroots involvement. And then also it blends primary care, public health, and preventative services, all of which are offered in a familiar and accessible setting. So if you guys ever get the chance to, practice in a rural type setting like that, it's going to be very beneficial to that community. You're going to be making a huge difference. So just kind of think about that in the future, if that would be something you'd be interested in. That would be, really beneficial. So the next chapter we're going to get into is chapter 20. It's promoting health through healthy communities and cities. There we go. All right, so in this chapter, some of our objectives. We are going to discuss the history of Healthy Communities and Cities movement. We're going to talk about the Centers for Disease Control and Prevention Healthy Communities program. We're going to describe core concepts and principles that guide the development of a healthy community program. We are going to describe the steps used when working with communities and Healthy Communities and Cities process. We're going to apply the steps in working with healthy communities and cities to the concepts of health promotion. And then we're going to explain the role nurses can assume in working with healthy communities and cities. All right, so some issues in public health nursing would be promoting healthy cities. That's one of the things. So this person, David Nadai, he said, "This is not your team of nurses. In fact, we're not all nurses. As far as I'm concerned, working with the Healthy Cities Initiative is the most fun you can have on a job as a nurse." David is part of a collaborative coalition made up of dedicated citizens and business and civic leaders who have come together to make their city a healthier place for everyone to live. All right, so back in 1986, there was a Ottawa Charter for Health Promotion. So this was the first worldwide action plan for health promotion. So they, the areas that they focused on were building public health policies. They wanted to create supportive environments. They wanted to strengthen community action, develop personal skills, and then reorient health services. All right, healthy communities and cities have different names around the world. So there are healthy islands, healthy villages, healthy municipalities, and communities. So here's a bunch of different terms that we're going to try to describe here. Healthy place, it's defined as one that's designed and built to improve the quality of life for people who live, work, worship, learn, and play within their borders, where every person is free to make choices amid a variety of healthy, available, accessible, and affordable options. Sounds great, right? Primary health care. This refers to meeting the basic health needs of a community by providing readily accessible healthcare services, because health problems transcend international borders. International cooperation is important to ensure health. Equity implies providing accessible services to promote the health of populations most at risk for health problems. So, for example, the poor, the young, older adults, minorities, homeless, immigrants, and refugees. Health promotion and disease prevention focus on providing community members with a positive sense of health that strengthens their physical, mental, and emotional capacities. Individuals within communities become involved in health promotion through community participation, whereby well-informed and motivated community members participate in planning, implementing, and evaluating health programs. Multi-sectoral cooperation is the coordinated action of all parts of a community, from local government officials to grassroots community members. Appropriate technology refers to affordable social, biomedical, and health services that are relevant and acceptable to individuals' health needs and concerns. Okay, so some models for community practice then. So the key models for community practice include the following. So locality development is a process-oriented model that emphasizes consensus, cooperation, and building group identity and a sense of community. Social planning stresses rational empirical problem solving, usually by an outside professional expert. Social planning does not focus on building community capacity or fostering fundamental social change. Social action aims to increase the problem-solving ability of the community with concrete actions that attempt to correct the imbalance of power and privilege of an oppressed or disadvantaged group in the community. All right, so here's a question for you. Which model of community practice stresses rational empirical problem solving? So your answer is going to be C, social planning. And again, this is just reviewing. So remember, social planning stresses rational empirical problem solving, usually by outside professional experts. Social planning does not focus on building community capacity or fostering fundamental social change. Here's another question for you. Which model of community practice stresses correcting the imbalance of power and privilege? This is going to be D, social action. And again, this just reviews what social action is. Social action aims to increase the problem-solving ability of the community with concrete actions that attempt to correct the imbalance of power and privilege of an oppressed or disadvantaged group. Okay, healthy communities in the cities in the United States. The CDC has developed a set of tools for community action that can be used in developing healthy communities. Some of these tools are as follows. Community Health Online Resource Center, formerly the Community Health Resource Database, which you could go to the cdc.gov/DCHCHORC to find assistance in planning, implementing, and evaluating community health interventions and programs that address their focus on chronic disease. The Community Guide, you would go to www.thecommunityguide.org to find evidence-based public health and community health interventions. And then also Community Health Assessment and Group Evaluation, or CHANGE. This is a tool where community leaders can use this to see what local policy systems and environmental strategies are currently in place in their communities and identify areas where health strategies are needed. CHANGE assists communities to define and prioritize areas for their own improvement. There are also action guides. The Community Health Promotion Handbook, Action Guides to Improve Community Health. In collaboration with the Partnership for Prevention program, the CDC has developed a set of how-to guides for 5 community-level health promotion strategies related to its chronic disease prevention target areas of diabetes self-management, physical activity, and tobacco use cessation. All right, so the CDC Community Health Promotion Handbook. So it has 5 areas of impact on health behavior: individual, interpersonal, organizational, community, and policy. So this is targeted for public health professionals, but can also be used by community leaders. All right, so when you use the handbook, there are steps to determine which areas to target. So you conduct a needs assessment, you set health priorities, you pinpoint factors affecting each priority, you pinpoint options for tackling the priorities, and then you evaluate acceptability and feasibility. So before deciding which of the 5 areas to target in your work, follow those steps. Healthy Municipalities and Communities Movement Mission. This strengthens local implementation. It makes health promotion a high political priority. It fosters government involvement. It fosters active community participation. It supports dialogue, which is good because you want people to be able to talk about things openly without issues. You share knowledge and experiences and stimulate collaboration among communities and nations. Okay, so in 2014, the National Civic League partnered with Community Commons to celebrate 25 years of healthy communities and to spread the ideas of insights and published in new online media. They emphasize the complexity of developing healthy communities and have identified 5 principles that they think should be applied in community work if the goal is to find solutions using a broad-based inclusive process. These principles are as follows: a broad definition of health that goes beyond the absence of disease to address the root cause of problems in communities and includes economy, education, parks and recreation, arts, mental health, and community spirit and unity. A collaborative, consensus-based approach to problem solving that involves a diverse group of citizens from the community. An assets-based approach to problem solving that defines people and relationships by their skills and abilities rather than the needs and deficits. Addressing challenges at a systems level in the community rather than implementing just another short-term, low-impact project. Creating a shared vision for the future that captures the hopes and dreams of the community and that guides collaborative work. Other principles that are useful in developing a healthy community. So the whole is greater than the sum of its parts. So change in one part affects all of the other parts. Collaboration is central in development of a healthy community. All systems have feedback loops, so information from one area is fed back to the whole. This feedback provides an opportunity for change or course correction. All right, so there are some models for developing a healthy community. So we're going to talk about some of those. So successful models will establish priorities after. So they do a careful assessment, and a great deal of community involvement is, had with those types of models. So for some examples, in 2012, there was something called the PAHO. It's a Healthy Municipalities and Communities movement. And then also in 1994, the Community Health Promotion Model Institute for Action Research for Community Health, Indiana University came about. So going back to that PAHO model, so what they did with this, they built a local support group. They know about Healthy Cities idea. They know the city and community. They gain financial support. They decide where the organization for the project will be located. They develop the proposal. They appoint a project steering committee. They analyze the project environment. They define clearly the work of the project, set up the project office, plan a long-term strategy, build project capacity, and then establish accountability mechanisms. Then going back to that community health promotion model, they orient the community to the idea of community health promotion. They build the partnership. They develop a structure in the community of health promotion. They determine who will lead the health promotion work. They assess the community. They plan for community-wide health. They develop community action for health. And then they provide the information based on data to policymakers, and then monitor and evaluate the progress. All right, and then the last slide here talks about issues in public health nursing promoting healthy cities. So again, they say, one of the things I like best about this job, that David guy we were talking about earlier, says, is the energy and exciting ideas that come from collaboration. No one group has a louder voice. Instead, all segments of the population, from leaders to business, to government, to public health nurses, to citizens groups, everyone's input is important. I really think people feel that here. I look forward to every meeting. So sounds like a great thing, right? All right, so we got one more that we're going to go through. This would be chapter 21. Let's see if I can pull that up. Okay, so in this chapter, it talks about the nurse-led health center, a model for community nursing practice. In this chapter, some of our objectives are describing key characteristics of nurse-led center models. We want to explain community collaboration, identifying interventions that address Healthy People 2020 goals. We want to determine the feasibility of establishing and sustaining a nurse-led center. We want to describe the roles and responsibilities of the advanced practice nurse in a nurse-led center, and then discuss the future of population-centered nursing practice, education, and research. Okay, so the first part of this, what are nurse-led health centers? So we're going to talk about, the definition of that, and then we're going to talk about the nurse-led models of care. So a nurse-led health center. Let's talk about that first. The term nurse-led health center or clinic means a nurse practice arrangement managed by advanced practice nurses that provides primary care or wellness services to underserved or vulnerable populations and is associated with a school, college, university, or Department of Nursing, federally qualified health center, or an independent nonprofit health or social service agency. All right, so on the slide, it also says there are some interchangeable names for this. So not only may you see just nursing center, but you could also see nurse managed health center or nurse managed health clinic. Okay, so nursing center models combine people, place, approach, and strategy in everyday life to develop appropriate health interventions. So these nurse-led models of care are community-based, they're culturally competent, they take a holistic approach, meaning they look at mind, body, and spirit. They are international and interdisciplinary collaboration, they have that going. They have multi-level interventions, community partnerships, and they are relationship-based. So some of the different types of nurse-led centers would be wellness centers, special care centers, comprehensive primary care centers. So like, for instance, wellness centers would be more like, maybe you do a lot of immunizations there, or you promote healthy eating and exercise and stuff like that there. Special care centers would be more like, hey, I'm focusing specifically on mother-baby care or something, or specifically on something else. And then comprehensive primary care centers would be just like going to your regular physician's office, except it's a nurse-led center that does it all for you. Okay, so wellness centers, they focus on health promotion, disease prevention, and disease management. They provide an outreach and public awareness. They give a lot of health education, which is great. Immunizations, family assessment, family screening, home visiting, and social support. These services definitely will complement existing primary care services. Special care centers, they have a specialized knowledge and skill about a specific thing. So they're looking at a specific patient group or a specific disorder. They would assist, they would be like an adjunct to primary care, and they serve as a hub for the public health nursing practice in home or community settings. So some examples of this type of care center would be, maybe there would be one that's focused on mental disorders or adolescent mothers or, infirmary older adults, something like that. All right, comprehensive primary health care centers. The primary care medical home for families is located in the community. You could have physical and behavioral health that they address. They look at the needs across the whole lifespan. So whether you're a baby all the way up until you're, old. They are federally qualified health centers and also National Nursing Center Consortium, members. So with public health programs, they do a lot of health education, screening and immunization. They look at lead poisoning prevention, home visitations. So they look at the nurse family partnership, and then early Head Start is another one. So public health programs include all of those things. And they're very helpful in certain communities for sure. Okay, so foundations of nurse-led center development. So nurse-led centers are meant to focus on multi-level prevention interventions, primary, secondary, and tertiary. So some of the reasons why this came about was because of some recommendations from the World Health Organization. Also by things that Healthy People 2020 has, came to light. Community collaboration and strategic planning is part of this. Maybe something came about because of, assessing a community and they saw an issue, so this came about because of that. Historical connection to the roots of public health nursing, there is that as well. So in your book, there's a resource tool, 21.b, that highlights the evolution of nurse-led centers. Okay, so for comprehensive community health improvement, strategies are needed at organizational, community, and socio-political levels. Nursing center staff may focus their efforts on system issues, community capacity, and family and individual health care access concurrently. Alternatively, the staff may concentrate programmatic efforts solely at the individual or family level and later address system and community issues. All right, here's a question for you. Which levels of intervention are nurse-led centers designed to provide? This would be C, primary, secondary, and tertiary prevention. And then this is just a review about that. Okay, the team of nurse-led center. So usually you're going to have a nurse executive that's the head of the whole team. You have advanced practice nurses working under the nurse executive. And then other people that might be working there would be business operational manager, data operations personnel, public relations personnel, physician collaborators, family therapists, mental health counselors, clinical social workers, and so on. Educators, researchers, students, and other members too. So it takes a village to make this work. Feasibility studies, business plans, and strategic plans lay the foundations for strong nursing centers. These components are crucial to the day-to-day functioning of a newly open nursing center and reflect the abilities of the management teams to build community coalitions and collaboratives. Generally, this is a business regardless, so you have to figure out how you're going to be able to sustain what you're trying to do and to make it profitable so you can continue doing what you're trying to do. Okay, so feasibility studies, we already talked about that. So establishment of a nursing center is warranted if the model reflects a need, an interest, and strengths of the target population. The model is economically feasible. Those are things you would have to think about. So when you look at the evidence-based practice model, the Health Insurance Portability and Accountability Act, that HIPAA, outcomes and quality indicators, quality improvement, technology and information systems. All of that has to be part of what you're doing in your center. And then with education and research, the World Health Organization priorities for nursing research agenda would be something you should be looking at. And then you need to make sure you do a program evaluation to evaluate how you're doing with your program. So you take a systematic approach, you improve or account for public health and primary care actions, and then you look at what works versus what does not, and then ask difficult questions as part of that. And then the very last slide talks about positioning nursing centers for the future. The effects of the Affordable Care Act and consumer demand on changing model of care, that kind of affects this. So there is an increasing need for healthcare in different areas. And, as our population gets older and there's less and less people to take care of everyone, this kind of stuff is super important because it will relieve some of that in the rest of the population if you have some of these centers. Also, some of the other things it talks about, effects of the Great Recession of 2008, the rise of retail clinics, the importance of professional organizations, the nursing workforce, policy development, and health advocacy in today's nursing. When it mentions the rise of retail clinics, that's like, your Bennett clinics, and CVS or some of these other, pharmacy places where they actually have a clinic where you can come in and get seen for certain things. So yeah, all of this kind of, positions nursing centers for the future, definitely. Okay, guys, so that is our stuff that we were supposed to go over this week. So I did already send you, I believe, in your email some practice questions for this stuff as well as stuff from last week. So please make sure you take a listen to this stuff and make sure you're taking notes and getting into the content so you're not behind. Hope you're having a good time off. I will see you soon.